Welcome to this comprehensive presentation on endometriosis. I am Dr. Swati Mehta and explaining about the endometriosis. Endometriosis is one of the most common causes of chronic pelvic pain, painful menstruation, and infertility in women of reproductive age. Despite affecting millions of the women globally, diagnosis is often delayed because symptoms can mimic other gynecological and gastrointestinal conditions. Today, we will explore the causes, symptoms, diagnosis, complications, modern treatment options, and important homeopathic therapeutics. Endometriosis is a disorder in which tissue similar to the endometrium, the inner lining of the uterus grows outside the uterine cavity. These abnormal implants may be found on ovaries, fallopian tubes, pelvic peritoneum, intestines, bladder, and rarely the distant organs. Because this tissue behaves like the uterine lining, it responds to hormonal changes during each menstrual cycle, resulting in inflammation, bleeding, and pain. The most common complaints are pelvic pain, menstrual irregularities, and fertility issues. Normally, endometrial tissues lines the uterus and shred during menstruation. In endometriosis, similar tissue grows outside the uterus, and during each menstrual cycle, the tissue thickens, it breaks down, and it bleeds. However, unlike normal menstrual blood, this blood cannot leave the body. As a result, inflammation develops, swelling occurs, scar tissue forms, and there is adhesions develops. Over time, this changes leads to chronic pelvic pain and reduce the fertility. This slide demonstrates the common anatomical sites involved in endometriosis. Notice how endometrial implants can affect ovaries, fallopian tubes, pelvic ligaments, uterine surfaces, pouch of Douglas, and understanding these locations helps to explain the diverse symptoms experienced by the patients. When endometriosis affects the ovaries, blood-filled cysts known as endometrioma or chocolate cyst may develop. These cysts contain old menstrual blood and can damage ovarian tissues. Long-standing inflammatory may lead to adhesions, scar formation, distortion of the pelvic anatomy, and these changes cause severe menstrual pain, painful intercourse, and infertility. The exact cause remains uncertain, but several theories explain its development. The first, retrograde menstruation. Menstrual blood flow backward through the fallopian tube into the pelvic cavity. Second, peritoneal cell transformation. Peritoneal cell transform into the endometrial-like tissue under hormonal influence. Third, embryonic cell transformation. Embryonic cells becomes activated by estrogen and developed into endometrial implants. Fourth, surgical implantation. During surgeries such as cesarean section or hysterectomy, endometrial cells may implant into the surgical scars. Fifth, lymphatic and blood vessel spread. Endometrial cells travel through the circulation to distant sites. 6. Immune dysfunction. The immune system fails to recognize and destroy the misplaced endometrial tissues. So these are the causes of endometriosis. This slide summarizes the major etiological theories and behind the endometriosis. Although no single theory explains every case, retrograde menstruation combined with genetic, hormonal, and immunological factors is currently the most widely acceptable explanation. Common symptoms include dysmenorrhea, that is severe menstrual cramp that may aggravate over the time, dyspareunia, that is pain during or after the sexual intercourse, dyschezia, pain during bowel movements, dysuria, painful urination especially during menstruation, heavy menstrual bleeding, menorrhagia or bleeding between the periods, infertility, difficult conceiving is frequent presentation. And general symptoms are fatigue, bloated, nausea, diarrhea, constipation. These symptoms often aggravated around the menstruation. The hallmark symptom of endometriosis is chronic pelvic pain. Pain intensity does not always correlate with disease severity. Even small lesions may cause severe pain, while excessive disease may produce mild symptoms. So, primary symptom of endometriosis is pelvic pain, and it is always associated with the menstrual periods. The some common sign and symptoms you already discussed, that is painful period, that is dysmenorrhea, then painful intercourse, pain while bowel movements or urination, excessive bleeding, that is metrorrhagia or menorrhagia, infertility, that is endometriosis because there is a severe pain and patient cannot do the intercourse properly because of the pain, and other signs and symptoms like fatigue, diarrhea, constipation, nausea, and blotting sensation we can find out in the patient. This slide visually demonstrates how endometriosis can affect the multiple pelvic organs and contribute to chronic pelvic pain and reproductive dysfunction. We can see here pain during or after intercourse. There is a reduced fertility, pain in other body parts. There is bowel problem, abdominal pain, and heavy or irregular menstrual bleeding. These are the signs and symptoms of endometriosis to keep in our mind. As endometriosis progresses, inflammation and fibrosis becomes more extensive. Repeated bleeding episodes can result into dense adhesions, organ distortion, tubal blockage, ovarian damage, and these changes significantly affect fertility and quality of the life. Approximately 30 to 50% of the women with endometriosis may experience fertility problems. Mechanisms include tubal obstruction, adhesions, impaired egg quality, altered pelvic environment. Ovarian cancer risk: when women with endometriosis have slightly increased risk of ovarian cancer, though the overall risk remains low, and rarely endometriosis associated adenocarcinoma may develop. Diagnosis begins with a detailed history and physical examination. Pelvic examination may reveal tender nodules, fixed uterus, ovarian cyst. Ultrasound for detecting endometriomas, pelvic masses, and however superficial lesions may not be visible. Then we have to go for MRI. MRI provides detailed visualization of deep infiltrating lesions, extent of disease, surgical planning. Laparoscopy, considered the gold standard for the diagnosis. The benefit includes direct visualization, biopsy confirmation, and simultaneous treatment. Conventional treatment depends on the severity, symptoms, age, fertility goals. The first is hormone therapy. The hormone suppresses the estrogen stimulations and reduce the growth. Gonadotropic hormones, agonist and antagonist. And these medications lower the estrogen production, induce temporary menopause, and shrink endometrial implants. The side effect includes hot flushes, vaginal dryness, and bone density loss. That means all the symptoms develop, that is of the menopause. Progesterone therapy includes some of the name that is given here, that is Depo-Provera or progesterone pills, and or they all suppress the menstruation and reduce the symptoms. Conservative surgery, that is the removal of the implants while preserving the reproductive organs. The benefits are pain reduction, improve fertility. Fertility treatment, the may include ovulation induction and intrauterine insemination, that is IUI or IVF. Hysterectomy with oophorectomy, that means reserved for the severe cases when other treatments fails and childbearing is complete. Model practice favors complete lesion excision rather than immediate removal of the reproductive organs. Homeopathic remedy selection depends upon characteristic pain patterns, menstrual symptoms, mental emotional state, and constitutional characteristics. Let us review the major remedies used in endometriosis. Xanthoxylum is a medicine to be thought of first because it is for the neuralgic dysmenorrhea or neuralgic pain. Severe neuralgic dysmenorrhea where the pain radiating to the thighs, there is ovarian neuralgia, black menstrual flow, there is left-sided ovarian pain, and pain extending along the genitourinary nerves. The constitution of the patient is thin, weak, nervous, and insomniac. Patient cannot sleep well. Mental features, depression, dreams of flying. This remedy is valuable when pain is intense, radiating, and neuralgic in character. We have to think about xanthoxylum. One peculiar symptom is also here, that is leukorrhea in place of menses. So that is also one of the indication we can find out. And another symptom, that is early and painful menstruation, especially pain in the lower abdomen, pain in the back down to the thighs along with the genital nerves. So all type of neuralgic pain we can think about xanthoxylum. Cimicifuga, there is an ovarian neuralgia, pain from hip to hip, pain radiates down to the thighs, irregular painful menses which is having profuse dark flow. So menses profuse dark coagulated offensive with backache, nervousness and always irregular, we can think about Cimicifuga. Patient is having depression, fear of impending evil, excessive talking and emotional instability. Patient having great depression with dreams of impending evil, that is the peculiar symptom of Cimicifuga, where there is a fear of riding in a closed carriage or being obliged to jump out. So when patient is riding in a closed carriage, always try to jump out, cannot sit. Cramps in the limbs and calf muscles, and mania following disappearance of neuralgia. So whenever there is a mania, the neuralgia or pain disappears. Violent pain, aching, shooting here and there, and shock-like pain, patient cries and patient faints. So patient is better by warmth and eating aggravated in the morning. So this is the excellent remedy for endometriosis associated with nervous and emotional symptoms. Sabina is indicated for profuse bright red bleeding which is partly clotted and partly fluid. Pain extending from the sacrum to pubis. Shooting pain upwards through the vagina. Used for menorrhagia. There is offensive leukorrhea. Bursting headache and sudden comes and goes, but it comes suddenly and goes slowly. That is the indication of Sabina. Music is intolerable and produce nervousness, violent pulsation, and patient wants the windows open. That is the mental features. So nervousness from music and desire for fresh air. There is bruised pain in the anterior portion of the thighs, shooting in the heels and metatarsal bones. That is also typical peculiar of Sabina. Aggravated by motion, aggravated by heat, better by cold fresh air. So this is useful when bleeding and uterine congestion are prominent. Bearing down sensation is a peculiar symptom of Sabina, with all the pains are from below upwards. Pelvic relaxation, patient sits with the crossed legs, bearing down sensation as if everything would escape through the vulva, prolapse tendency, painful intercourse. So violent stitching upwards in vagina from uterus to umbilicus, and it is aggravated by while sexual act. Irregular menses. So there is a weakness in small of the back, pain extending into the back, and menses too late and scanty or irregular, early and profuse. Lower extremities are stiff and tension as if too short. Heaviness and bluish feeling. Restlessness in all the limbs, twitching and jerking day and night, and pain in the heel. Mentally, patient is indifferent to whom she loves best. Irritability, desire for solitude, emotional exhaustion. So Sepia is one of the most important remedies for chronic pelvic disorders with hormonal imbalance. Nux vomica is adapted to thin, irritable, careful, zealous women with dark hair and bilious or sanguine temperaments. Means those women who lives sedentary life, you can use Nux vomica for that. Patient is having spasmodic dysmenorrhea, frequent urge for stool during menses, black menstrual blood with sacral pain and irritable temperament. So menses too early, profuse, last too long or keeping on several days longer with complaints of onset and remains after. Every 2 weeks patient is having bleeding. So you can use it for metrorrhagia. Patient is never at the mens is never at the right time and stopping and starting again. Pain is violent, spasmodic, causing urging to stool or urinate is the typical symptom of nux vomica. There is a pain in back and patient prefers warm room. Cramps and dysmenorrheal pain which spreads over the whole body. Blood is black with faint spells and pain in sacrum and constant urging to stool. That is also one of the peculiar symptoms of nux vomica. Mentally, patient is ambitious, oversensitive, easily offended, anxious with irritability. Patient is aggravated by mental exertion and better by rest. So especially useful in sedentary overworked women with marked irritability, the nux vomica is indicated. One of the greatest challenges in treating endometriosis homeopathically is selecting the correct remedy among several medicines that appear similar. While many remedies cover dysmenorrhea, pelvic pain, ovarian neuralgia, and menstrual irregularities, but each medicine possess characteristic or peculiar symptom that make it unique. The key of the successful prescribing lies not in the diagnosis alone, but in identifying the patient's individual pain pattern, menstrual characteristics, emotional state, and modalities. So let us compare the important remedies used in the endometriosis and learn how to differentiate clinically. So Xanthoxylum, Cimicifuga, Sabina, Sepia, and Nux vomica we are going to differentiate. The nature of pain in Xanthoxylum is neuralgic, while in Cimicifuga rheumatic, Sabina congestive, Sepia bearing down, and Nux vomica spasmodic. The direction of pain in Xanthoxylum ovaries to thighs, Cimicifuga also ovaries to thighs, in Sabina sacrum to pubis, in Sepia below upwards, and in Nux vomica sacrum with urging. Menstrual flow in Xanthoxylum is thick and black, Cimicifuga dark and clotted, Sabina bright red, Sepia irregular, and Nux vomica black and profuse. Mental state in Xanthoxylum depression, Cimicifuga fear or gloom, Sabina nervousness, Sepia indifference, and Nux vomica irritable. Peculiar symptoms in Xanthoxylum dream as if flying, Cimicifuga fear of impending evil, Sabina, music intolerable. Sepia, bearing down sensation. And Vomica, constant urging to stool. Side affinity, Xanthoxylum is for the left side ovary, Cimicifuga for ovaries in general, Sabina is uterus, Sepia all the pelvic organs, and Vomica for pelvic congestion. Whenever endometriosis symptoms are predominantly left-sided, Lachesis should come in mind. The patient is usually intensely emotional, talkative, and congestive. Patient is having left ovarian pain. Patient cannot tolerate any tight clothing around the abdomen. Patient's symptoms aggravated before menses and relief when menstrual flow begins. Patient is hot and very talkative. Here we can find out the flushes of heat is present. Another feature is aggravated into slips and slips into aggravation. And the mammae are inflamed and bluish in color with coccyx and sacral pain, especially on rising from the sitting posture, and it acts especially well at the beginning and close of the menstruation. So clinical differentiation, if you can see, unlike xanthoxylum, pain is congestive rather than neuralgic, and unlike sepia, patient is expressive rather than indifferent. So keynote symptom is left-sided ovarian pain relieved by menstrual flow. Palladium is the mirror image of Lachesis regarding the laterality. It is especially useful in right ovarian disease, right ovarian pain with pelvic heaviness and desire for praise and appreciation, symptoms aggravated by social disappointment, and there is an ovarian enlargement, weeping mood, patient is having love of approbation, patient is pride and easily offended, inclined to use violent language, patient keep up brightly when in company but exhausted afterwards, and pain is aggravated. So clinically, if differentiation is, unlike Lachesis, symptoms are right-sided, unlike sepia, patient seeks recognition and approval. So right-sided ovarian pain with desire for admiration, we can think about palladium. Additional remedies. Potentized estrogen may be considered according to the homeopathic prescribing principles in selection of the cases. Lachesis is usually used when symptoms are predominantly left-sided, congestion is marked, symptoms aggravated before menstruation, while palladium is useful when symptoms are predominantly right-sided, ovarian involvement and is significant, and remedy selection should always be individualized according to the totality of symptoms. In endometriosis, remedy selection should be based on the characteristic symptoms rather than the diagnostic alone. Remember these keynotes that xanthoxylum when there is a neuralgic pain radiate to the thighs. Cimicifuga, ovarian pain with fear and depression. Sabina, bright red bleeding with sacrum to pubic pain. Sepia, bearing down sensation and pelvic relaxation. Vomica, dysmenorrhea with constant urging to stool. Lachesis, left-sided ovarian involvement. Palladium, right-sided ovarian involvements. So these peculiar symptoms are the true guiding symptoms that help differentiate one remedy from another and leads to accurate homeopathic prescription in cases of endometriosis. Endometriosis is a chronic estrogen-dependent inflammatory disorder that can significantly impact quality of the life and fertility. Early recognition, accurate diagnosis, and individualized treatment are essential. A comprehensive management approach involving lifestyle modification, conventional treatment, and carefully selected homeopathic therapeutics can help improve symptoms control and overall well-being. Thank you for watching this video. Please like, share, and subscribe for more educational videos on gynecology and homeopathic therapeutics.